Thank you. And today, our first point of today's session, that is point 51. Those who are new, those who have not attended the first session, will be sharing in the YouTube. You can connect there. We can have a session. Then you can connect with the part 2 as well. So point 51 of today's session. So coffee is a common antidote to too many drugs, yet it increases the excitement and frenzy produced by the other remedies, that is like cantharis. It complicates the cases of colchicum, coffee, and chamomilla are in the same group and are likely to upset the effects of one another. So this is one theoretical part of point from the SP Koppikar's experience. Like what Sir has wanted to say is that coffee is an antidote to many drugs. So generally, when we prescribe any medicine to a patient, we say you need not to take coffee, or you need not to take any tea, or you need not to take any spicy items. So that is a common antidote to almost all the drugs in the homeopathic metromedica. And coffee and chamomilla are in the same group from the same family actually, because these both have a tremendous action in extreme pains. Like there is one rubric from synthesis: mind pain besides oneself. In that the coffee is high grade, chamomilla is also high grade remedy. So painful remedies you can think of. Where is an extreme pain, patient cannot tolerate, you have prescribed some medicines of your constitution or indicated medicine, it's not at all working. So in such cases, you can think of this remedy. And coffee is a wonderful remedy, as a wonderful mind symptom. Like if you open Kent repertory, single remedy, benevolence, mind benevolence, single remedy, coffee cruda. That means coffee is more of kindness, helping nature, very joyful. Such a state you can see in coffee cruda. Next point important here. Coffee must not be used when China and Noxomica is used. These clinical tips or these points are must necessary. You need to understand when to prescribe what remedy and when not to be prescribed. So coffee cruda must never be used when China and Noxomica is used in the case. Or you prescribe China for loss of vital fluids, or Noxomica for stomach derangements, and immediately you think of giving coffee. No, you must not. It antidotes the action there. That is what Sir wanted to tell us. So here we are come across the two remedies, China and Noxomica. I'll tell you the clinical tips and clinical hints of this remedy, how to use. China, one of the main thing I will tell you is this connects with some of the mind state actually. For example, if a patient comes and says, doctor, na, I'm getting a lot of pains, knee pain, joint pains. Na. Due to these pains, I'm not able to work. Due to these pains, I'm not going to office, doctor, because I'm not able to work. I feel I cannot work with these pains. In Telugu, I can say, doctor, ఈ నొప్పుల వల్ల అసలు నేను పనే చేయలేకపోతున్నాను, పని చేయబుద్ధి అవ్వట్లేదు, అసలు పని చేయబుద్ధి అవ్వట్లేదు, ఈ నొప్పుల వల్ల నాకు అసలు పనికి ఆ ధ్యాస ఉండట్లేదు. సో దట్ ఈస్ వాట్, లైక్ పేషెంట్ టెల్, I cannot tolerate this due to this pains, I cannot work. There is one rubric from synthesis or Kent, you can think, mind delusion hindered work it. Single remedy China, single remedy. That means the patient is in a delusion pattern that due to these pains, he cannot able to work. Due to these pains, he stopped working. Due to these pains, he hindered at some place, not able to move, not able to do any work. China single remedy. Mind delusion hindered work at single remedy China. It does wonders when patient able to say the same point for stressing on the same point constantly in the case taking. This is China's mind state. And China plans many, but cannot able to execute that. If you open Fartech, plans many, cannot execute. Single remedy China there. But coming to the other remedy, which has these plans many, can execute, it is stannum metallicum. Stannum metallicum. Almost all the metals have their ideas and they will execute in a proper, perfect manner. So metals, if you think of any metal group of remedy, they have exact plan, they have exact preparation, they have exact idea when to execute, when not to execute. They're very, very perfectionist. But China is not like that. Plans many, cannot able to execute. That is China. Noxomica, we all know, very jealous, very ambitious, very anger, contradicted. and with stomach complaints. This is the beauty of these two remedies. Are you all understanding it? Is it clear? Is it going well? Please do text so that I move forward. Is everyone understanding these points? Is it clear from my side? Yes, thank you. Coming to the next point from this book. Dr. Kent says, when your patient is under the influence of either carbovage, pulsatilla, you will not surprised if the stomach becomes disordered after eating fats or greasy, rich food. Understand. That is the action. This you need to understand. To understand these symptoms from the patient, you need to understand the remedy sphere of action or the remedy genius core or the remedy pathogenesis, how it works on. If you understand that very clearly, you are able to understand what changes in the patient is going through, and that will guide you to prescribe the remedy or change the remedy or keep on SL or you just continue with the remedy. This is the beauty. This is the beauty. See, Metromedica is not just learning the remedy patterns, keeping the mind blindly or by heart it. That's not. You need to observe. You need to understand. You need to grasp each and everything from each remedy and just apply in the patients. You will see a beautiful results. Beautiful. Coming to the next point here, when your patient has been many days under bryonia, lycopodium, petroleum, and he comes in and complains of any disorder, stomach, and saying you must have been eating cabbage. That is the beauty. So cabbage aggravations are these remedies, bryonia, lyco, petroleum. We all know stomach disorders with carbovage, pulsatilla. Pulsatilla cannot able to eat outside food, cakes, pastries, causes stomach derangements. And weeping while telling the symptoms, pulsatilla, key confirmatory, very sympathetic nature, very yielding disposition you can see in pulsatilla, very mild nature. And I will tell you one clinical tip to prescribe pulsatilla is the sleep position is very, very important to prescribe. Whenever you're prescribing pulsatilla, ask where you sleep and in which position you sleep. If patients sleep, I sleep on the sides, okay. Where your hands keep, hands under the cheeks and they sleep like this. Confirmatory is pulsatilla. And carbovage, it's a beautiful remedy for never Welsing's. For never Welsing's, any diseases, any illness. You have prescribed many remedies, not at all working. You can think of carbovage as your remedy. Coming to the next point. Often very important to warn patient against indulging in a cold and frozen foods after giving arsenic, lycopodium, naxomica, rustox, and pulsatilla. See this, arsenic, aggravations from the cold foods, lyco, naxomica, rostoxicodendron, and pulsatilla as well. So that is what you need to understand this. Often very important to a warm patient against indulgence in the cold and frozen foods after giving these remedies. That you need to keep in mind. So that's why the previous prescription is very, very important to understand this next follow-up the cases. This helps you in second prescription of the patient as well. This you need to keep in mind. Next point here. If under the influence of Thuja, to avoid oysters. So if patient is Thuja, ask the patient to avoid oysters. This is the beauty. And ask the patient to avoid onions as well, because Thuja craves the onions at the same time it aggravates. At the same time it aggravates. And actually, I'm dealing one of the beautiful case of Thuja patient itself. He came to, he is my previous patient actually. He came to me and said, doctor, I traveled to some place for some work for 3 or 4 days. There outside I eat fried rice, but in that I think they kept onion. After that, I started a lot of coughing. And I feel something is stuck here. And when I went to the repertory there, Thuja is one remedy, that is onion aggravation, and he craves for it. At the same time, he said, here's some ball-like stuck, something his throat is stuck, and it is exactly written Thuja there, in the Thuja of the throat. So this is the beauty. When you catch the whole thread of the remedy, the genius runs through it. The genius runs through it. To, under the Thuja influence, never ask them to eat oysters. Avoid them. That is one of the clinical confirmatory what SP Koppikar sirs want to say with us. Along with that onions, tea is so much craving for Thuja patient. What's oil greasy remedy? Face is so much of oily. It's a psychotic remedy to cover the weakness. And this remedy comes very close to meteorinum again. Coming to the next point. Patient suddenly becomes disturbed from drinking milk if under the influence of Kalika, nitric acid, sepia. So almost all these patients of sepia are aversion to milk. I will tell you one remedy, a sepia as well. I think it is written in boric, yes. Cold milk causes diarrhea, sepia. When patient says, doctor, I am not able to have a milk. If I have milk, it causes diarrhea. Sepia is the remedy. And sepia is aversion to milk. At the same time, cold milk craves for rustoxicodendron. Other remedy is rustox. At the same time, the cold milk aggravation is sepia, right? Nitric acid also have this aggravation from the milk. Kalika Biono, they craves for pica, undigestible things, slate pencils, chalk pieces, and Calcarea cup craves for boiled eggs, we all know. That is the remedy. So this, why I think why Koppikar sir has mentioned all these points, like from, I can say you, yeah, from point 51 to 56. These are very, very important. Generally, we avoid this whenever we prescribe and we say, Array, our remedy is not working. Yeah, it worked in the first time. Then again, it's not at all working. Again, this, that came to the back to the normal state. There is some obstacle for cure. That obstacle for cure you need to understand. Yep, we'll clarify your doubts. You will clarify your doubts. Please make sure write your doubts in one paper. Once the session is done, we'll have discussion at the last. Thank you. So these obstacles from the cure you need to understand. If you read Stuart Claus' philosophy very well, he writes obstacles from the physician, obstacles from the remedy, obstacles from the patient. So these three are very, very important. Whenever you try to prescribe the remedy, you need to have a careful observation of each patient. Coming to the next point, if the patient is under the influence of Antimonium crudum, ask them to avoid sour things, vinegar, and sour wine. This is the beauty. And Antimonium crudum is wonderful remedy for disappointment of love. Generally, we think of Natrum, Ignitia, Staphysagria. It has same grade of action in disappointment of love. If you refer Fatak repertory, love sick, only two remedies. One is Antimonium crudum, another one is Stela europea. And Antimonium crudum having a beautiful tongue, very whitish. Whenever you prescribe in any acute case of Antimonium crudum, see the tongue. If it is whitish, prescribe Antimonium crudum. And the craves for Indian pickles, spicy Indian pickles, is Antimonium crudum. And it's a beautiful remedy for corns. When indicated, coming to the next, whose children are under the influence of ignitia or argentum nitricum, to keep candy away from them, or you will have a disordered stomach and diarrhea. See this point. Ignitia argentum nitricum. Whenever you are prescribing to ignitia child or argentum nitricum child, how they behaves, very anticipatory anxiety, very restless, narrow places aggravation. They always craves for this candy, sugars. Mama, candy, sugar, every time craves for that. Argentum nitricum is a wonderful, wonderful remedy for craving of sugar, for craving of sugars. Not in some other chocolate, some other items, exact craving of sugar you can see in this remedy. That's what the SP Koppikar has said in a candies. It has a lot of sugars there. Coming to the next remedy, and nitrum carb, aggravation from music, milk, sun, that is summer, keynotes to be noted. So this is one thing. So almost all here, these physical generals are coming into the role of picture to describe or to prescribe a remedy. That is what I do in my clinic actually. Whenever I'm confirming any remedy, either at the constitutional level, either at the indicated remedy, either at the acute remedy or chronic remedy, what I am going to prescribe the patient. For sure, I will ask this all the physical generals very clearly, very clearly. If I am giving the patient Natrum carb who is in front of you, I will ask this symptom. Do you have a milk craving? No, no, doctor. I don't drink at all milk. From how many years? No, from childhood. No, doctor, I don't drink milk. What will happen to your milk? I don't know, but I don't like it all. Okay. Whenever you go to sun, do you get headache? Doctor, I get lot of headache whenever I go to sun. Sun aggravation, nitrum carb. That is some confirmatory. Another beautiful confirmatory, like Fatak has written, is ankle sprain easily. Ankle sprain easily. Patient says, doctor, now whenever I am going for walk now to college now, whenever I about to step 2 or 3 steps, my ankle will sprain, like turn easily. Again, if I walk for a few minutes, again it turns easily. This is happening from long years. Don't know why. Nitrum carb. Ankle turns easily, nitrum carb. Single remedy from Fatak repertory. Single remedy. Along with that, you need to have this confirmatory of music, milk, sun at the physical level. But at the mental level, nitrum like disappointment, nitrum like introverted, carbon like lazy, carbon like dullness, carbon like security, insecurity possession. That you need to match. Then the picture of nitrum carb works wonders in nitrum carb patients. Is it clear? Is it going well? Yes. Coming to the next point, that is 60. Cruel nature or a cruel habits, then think of anacardium. Actually, anacardium is a beautiful remedy from cruelty. And I have done my paid session about anacardium, and we have done 6 polycross remedies of understanding the genius core of each remedy very clearly. In that, we have uploaded in your YouTube of this anacardium. You can go through very much cruel. How anacardium is so cruel, we have explained beautifully in our channel. You just go through and have a look at it. It's a beautiful remedy of understanding anacardium there. And other remedy, very cruel at the child is abrotinum. Cruel, uncivilized child is abrotinum. And we described abrotinum there as well. Coming to the next, hair fall out in a handfuls from definite areas. That is alopecia areata. Think of phosphorus. And I will tell you here one notice or warning, you can say. See, here sir's clinical experience has shared with us. That means if you get a case of hair fall, you phosphorus, that's not. This is just for a learning purpose, understanding the remedy for you all. And there are some clinical tips as well, which are we have discussed that you can apply. But here, in any hair fall, phosphorus will work? No, never. Constitution prescription. If that is failed, this is the other alternate to help the patient there, that you must keep in mind. Okay, next thing, hair fall out of handfuls is phosphorus, I said. Tell me the other remedies for hair fall, especially after acute illness. Patient says, doctor, na, I suffered from COVID last year. Then after that, full of hair falls, a bunch of hair falls coming. What could be the remedy? Do text fast. Waiting for your suggestions. So we'll have a discussion. It is not like one side speaking. You also have a discussion so that you'll understand what remedy comes when patient says after any acute hair fall, any acute fever, then my hair fall started. Nitromur, okay. Thallium metallicum. That's beautiful suggestion of thallium metallicum. Yeah, beautiful. That is what thallium metallicum is a wonderful remedy. Wonderful remedy. It was given in boric. You can see hair fall after acute illness. So generally, what I learned from my gurus are to whenever you prescribe the constitutional medicine for this alopecia areata, and patient is responding well, good, going well, and you can have an intercurrent of thallium met 30 or 200 weekly once and one dose that can help you. Okay, the other remedy for hair fall after acute illness is mancinella. I did one beautiful case with mancinella actually, and with Mindstate actually matching there. From boric you can see mancinella. The other remedy, especially after typhoid, there is a hair fall, you can think of the remedy fluoric acid. And some doctor has suggested carboveg. Yes, carboveg never well sinks any particular diseases. You can think of carboveg there and then itself. But above going to prescription of carbovage, try to prescribe this, try this thaliamate or mancinella or fluoric acid. Then that is not working. Then you can go for the other remedies there. Some doctor has suggested Vyathia. Yeah, Vyathia is not a hair fall remedy, but it is a more of an allergic rhinitis remedy. Visbidin is one remedy actually. Visbidin aqua. Visbidin aqua you can give in 30 potency for hair fall or for hair growths. It works wonders. Visbidin. Visbidin 30 low potency or 60. And speaking about potency is not the mother teachers. Next, coming to the next. A ring hole in the lobe of ear becomes ulcerated. So ear ring hole ulcerations. Think of the remedy Stannum metallicum. Stannum metallicum. It's a beautiful remedy, and this again was mentioned in boric actually, stannum met. And it's a respiratory remedy. A lot of coughing, cannot able to speak, talking also, lot of chest weakness with lot of coughing. You can think of the remedy stannum metallicum there. So other remedies Fatak has mentioned his Kalimur and Medorinum. Kent has mentioned lachesis, actually single remedy there, along with stannum. So to prescribe Kalimur, we have done one short video which we are going to upload tomorrow. Kalimur clinical indication, how to prescribe and when to prescribe. Medorinum, we all know it is a nosode with a lot of laziness, lot of postponement, sleeps on abdomen, past history of UTI, craves for cucumbers, craves for green grapes are some confirmatory symptoms of Medorinum. Coming to the next. Suffers from the habit of biting their tongue or cheek when chewing, then think of ignitia. See, suffers when a habit of biting the tongue or cheek like this. Whenever able to chew, they start biting their tongue. This is happening recurrently. In such cases, you can think of the remedy ignitia. And in Kent's repertory, given two more remedies are, one is causticum, other one is nitric acid. And these two remedies are beautiful remedies in Metromedica, which are very, very sympathetic, very, very sympathetic. Causticum, nitric acid, the other remedy, phosphorus. These three mind states are very, very near and that differentiate in some stages that we are going to discuss in our upcoming sessions of this causticum full remedy, nitric acid and phosphorus as well. Coming to the next, biting tongue tip, exactly the tongue tip, sleeping during. The remedy is Theridion. It's a spider group remedy, and Theridion is a beautiful remedy for ADHD cases. In autism, in children who are very restless, very, very suspicious, like spider, like restless. You can think of the remedy Theridion. Theridion is a beautiful remedy for back pains. Back pain, back spine, even the smallest touch causes a lot of pain. The touch causes hysteria in Theridion as well. And one of the key confirmatory Theridion, if you're prescribing to a child, ask the patient or ask the mother that does your child craves for eating bananas? If yes, he is pakka 100% Theridion. Works wonders there, works wonders. Biting tongue while talking, Alzheimer's, due to maniacal state of Alzheimer's. Shamelessness, highest sexuality, craves for apples but not able to eat. Lot of delusions, you can see delusion being poisoned, delusion someone is there behind me, delusion I'm suffered wrong. It's a beautiful, beautiful remedy in maniacal stages. In psychological point of view, in psychiatric cases, Alzheimer's works wonders. Coming to the next point from Kent's Metromedica, Mercurus, a great medicine for mumps. It cures when the symptoms agree. Nitric acid will cure blowers as often birds, Burnett's if symptoms agree. So these are some states actually. If you go through Google, you just search these words, you will understand the appearance of the build of the patient. That is what Sir has said here in his book. Plumbum, very, very historical state. Feigning sickness, it goes to the root of the evil, provided the symptoms agree. See, feigning sick is act like I am very sick, but I am not sick. That is the state of plumbum. And Tarantula is wonderful remedy in this feigning sickness. Very, very historical state, a lot of brain fag like plumbum, and it's a beautiful remedy for multiple sclerosis. In In sclerotic conditions of brain, you can think of the remedy plummet. Coming to the next point, the opposite actions of high and low potencies. This you clearly and make sure understand what sir has written in his book. With iodine 200 and 1000, I have added weight to lean and even emaciated boys and girls. And iodine 2x, 3x are the best remedies to help in the reducing obesity. Give 3 to 4 pills 3 times daily. That was sir's clinical experience, right? They are the best remedies and helps in reducing the obesity. Give in 3 or 4 pills 3 times daily. Iodine 2x and 3x. The other remedies are fucus, which is of neem plant extraction. Fucus is also a wonderful remedy for obesity if indicated. Other remedy, Phytoleca beriberi. There are two types actually, phytolecas. Phytoleca beriberi is wonderful remedy for reducing obesity if indicated with some particular symptoms of the remedy there. But sir's experience is saying that 2x, 3x works wonders. I have used Bryonia 200 to dry phlegma and sixth potency when there were too much of dryness in the air passages or for similar action on the synovial fluids in the large joints like knee joints. I will tell you one beautiful tip actually. See, this is what here you see when to prescribe 30, when to prescribe 200, when to prescribe 1M is based on the pathological condition of the patient and is based on the physical generals matching to the patient. This is very, very important. That is what sir has mentioned here. Bryonia 200 to dry phlegma and sixth potency when there was too much of dryness. So if there is a lot of dryness of Bryonia, Bry is equal to dry. Why sir has prescribed sixth potency is because that is the pathogenic state of the remedy. There you go for lower potencies, works wonders, works wonders. Actually, this is what I learned from my guru as well. So in Thuja cases, in Thuja, that is what I'm explaining. In Thuja, suppose if you find a patient of Thuja and he says, I'm craving for onions, at the same time aggravation, give Thuja 60. If patient is not at all speaking about onions, but he is Thuja-like symptoms, give Thuja 30. This is what a prescription is made. See, we are into the right remedies. We know each and every medical line and we have prescribed right remedy. But potency is most important to get the actual cure from the patient. That comes from the knowledge. Oh, wait for a while. That comes from the knowledge of understanding the remedy and at what stage the patient is and what potency to be prescribed there. That is most important in prescription of homeopathic side. Point 66. Single collective dose means giving 2 or 3 doses on the first date intervals of 3 or 4 hours followed by placebo if necessary from the next day. So Dr. Kent and others are also use this method. This is what Kent's method actually. Single collective dose means giving 2 or 3 doses on the first day at intervals of 3 or 4 hours followed by placebo. This is what how Kent has followed. But in the 6th edition of Organon, to change the dose slightly every time the medicine is repeated, this medicine is called plus dosage. This medicine is called plus dosage. Yeah, wait for a while. I'll just come back. Like my charging is very low. Within 1 minute, I'll be back there. Right? Is it audible? Yeah. So coming to the 6th edition as well. So to understand 6th edition very well, try to read two aphorisms, that is 247 and 248, where Hahnemann has mentioned how to give this liquid potency. Until 5th edition, Hahnemann has mentioned of dry dose prescription. Once if you understand the 6th edition very clearly, that is aphorism number 247, 248, And Master Honeyman has clearly mentioned to prescribe in liquid doses. And that is what I do in my clinic. Gives wonderful results in immediate effect. I will say you in immediate effect. Many says homeopathy is late, but I get results within 5 minutes, 10 minutes of dosage with intensity change. I'm saying complete cure not. With intensity of sufferings will come to the radios when you prescribe a right remedy at right intervals, giving it in a right intervals of time. Please try to refer 247, 248 aphorisms from 6th edition. Coming to the next point here, ornithogallum. It's a beautiful cancerous remedy, I'll tell you. Ornithogallum, actually, Faruk Master sir has used this remedy very well. I read it, his books, so that's what I'm saying. And SP Koppikar sir also mentioned here. Is the remedy to consider in chronic gastric and other abdominal indurations, possibly cancer. Look, CEO of esophagus, CEO of stomach. In such cases, ornithogallum 30 or 60 does wonders. The other remedy you can think of is Condurango, cancer of esophagus. But the main prescription for Condurango is at the cracks at the lips. Here it is too much of cracking at the corners of lip. You can think of this remedy. The other remedy I will tell you is sedum repens. Actually, sedum repens. If you read from Boric, it is there. It is also a beautiful remedy for cancer of intestines. Sedum repens. The other remedy from the same family, sedum acre, it does wonders in hemorrhoids, fissures, when your nitric acid or when your asculus, when your colonsonia, when your sulfur is not at all working, you can think of sedum acre. Sedum repens is for cancer, sedum acre is for hemorrhoids and fissures, ornithogallum for stomach cancer. Condurango is also one of the beautiful remedy for CEO of stomach, that is esophagus. When the gross pathology change but not found in any special constitutional symptom or mentals, here large doses of crude drug worked wonderfully while high potencies does failed. This is what you need to understand, doctors. Whenever the patient is in the gross pathological change, that is what I said. If the cancer is a gross pathological change, when you prescribe higher doses, patient go into the state of worsen. Try to prescribe in low potency, that is 6C, 12C, or 30C. That you need to understand. When the gross pathology is high, the susceptibility is very low, very low, very low. So potency has to be very low. This is beauty of right prescription. This is the classical understanding of the remedies. On the other hand, a constitutionally indicated remedy, not necessarily covering the pathology, understand this line, give good relief in a far advanced cases of heart disease. It's two beautiful lines. If you understand these lines very easily, it's beautiful, beautiful, beautiful. See here, gross pathological change, and you are prescribing remedy that is pathological, that is organ specific remedy or doctrine signature remedies, try to give in low potency. And same gross pathological changes or advanced pathological cases, but you find the patient constitution, higher potency will also help the patient. Are you all understanding this? Please text it. These 2 points are very, 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 very necessary for your prescription. Is it clear for you all, these 2 points? Please do text. Is it clear? Waiting for some responses. Is it clear? You all understood? Because our main point is to understand everyone. Okay, I will repeat it. Are you all understanding these 2 points? Please do text. Please have a response. Please have a chat. So once again, I'll repeat and I'll go fast further. See here. So whenever this gross pathological change, like I will tell you, for example, if you're treating a case of spleen and patient is not able to tell any modalities, anything, but spleen is the major organ, what is about to say. So you have prescribed sionathus. So here what you are doing, you're matching the remedy for pathological change. So try to prescribe in low potencies. And same scene, that is splenic remedy, spleen complaints, patient has said location, modalities, concomitances, and patient constitution you have found. then you can go for higher doses. That gives results. These are the two important prescriptions in your clinic so that you will be able to cure cases in a right manner. Thank you. Coming to the next point, we'll go fast further. This teaches us that when indicated remedy fails, when given low, it is better to try high potencies rather than changing the remedy. Here, the indicated remedy is the constitutional remedy. They are typically serious, acute cases cured by masters of Formator Medica with high potencies. The weaker the patient, the more he is susceptible to the right remedy. The more accurate the prescription, the higher should be the potency. So this is the gist of the two above points. So on the other hand, chronic deep-seated pathogens with morbid changes in the structure of organs or parts can only be successful treated with very low potencies and mother teachers. But generally in my clinic, which I learned from my guru, in my clinic, I don't use any mother teachers. The same medicine I'll prescribe in low potencies. The same medicine I prescribe in low potencies. Like I'm not a practitioner of mother teachers or biochemics. I just prescribe only the dilution potencies. Next remedy, pus formation even in bones can be marvelously cured with third potency and even 1x. High potencies could have made matters worse. This is what this is you need to understand. Extremely active curative process is a dangerous in these conditions. Is dangerous in these conditions. So that is what we generally fail to prescribe in silicia heparsulf cases, right? With you pus formations, hepar silicia, generally I'm speaking there. And you have prescribed heparsulf or silicia in 1m 200 repeatedly, then that patient is going into the state of worse and not the cure. So in that cases, prescribe in low potencies, starts with low potency. If it is going well, then pulse up the dosage. This is most important in the prescription. We are well versed with Medica. We are well versed with case taking. We are well versed with identifying the remedy of the patient. We are well versed in taking right rubrics for the remedy, right rubrics for the patient. But we are not well versed in giving right potency. Everything is, I think, waste of knowledge. I mean, waste of knowledge in the sense not able to cure the patient, right? So that you need to understand. That is the magic of understanding the homeopathy well. So Dr. Burnett, one of the beautiful writer, previous sessions who have attended my sessions, they know because I generally stress on the Burnett's well. With his tremendous observation and a remarkable study, found out Calcaria sulfuricum to be the remedy that might help the cleft palate and hairy lip. In cleft palate cases and hairy lips, Calcaria sulfuricum is a beautiful remedy. It's a beautiful, and it has worked in my one of my guru's cases as well. And it's a beautiful remedy as well, like calcarea like symptoms, sulfur like ego, sulfur like embarrassment, calcarea like insecurity. You can see that. Young, vigorous people are more susceptible. They need higher potencies than old people. This you need to understand. This is temperament. This is called what I call it is a temperament. Similarly, delicate, sensitive, nervous, intellectual people need high potencies. Need high potencies. Courage, tropid, phlegmatic people need low potencies. So to understand these words, you just have a screenshot and try to Google it or try to search what is phlegmatic, what is tropid, what is vigorous people, who are intellectual people, what are delicate people. You will understand very clearly. And which thing we need to prescribe what dose. This is important. This is important. Actually, this is a very big class, and we have done this session actually in our YouTube. It is there like constitutional prescribing and the temperaments. You can go through there and you can have a watch it there. Next remedy. Dr. Kent and others swear by Naja and Spongia and Calcarea floor to help and build up the heart values. So in cases of heart values weaker, think of these three remedies. One is Naja, which is of a snake remedy with lot of hemorrhagic tendencies, blackish hemorrhages. You can see they're very, very suspicious, very, very jealous of Naja. Spongia, saw driven dust like cough. Lot of spongia, cough, respiratory complaints. with a lot of respiratory complaints. You can see there in spongia. Calcarea floor is a beautiful remedy for bony diseases, for necrosis of bones, and is a wonderful remedy for hard deposits anywhere in the body. If lipomas are hard, nothing is helping, you can think of calcarea floor. If lipomas are soft, you can think of Lepisolva. Calcarea like state and fluoride like state, you can see there. Dr. E. M. Hale, the law of dosage follows. If you prescribe a drug for symptoms similar to its primary effects, we must use high potencies. Low doses will amel. But if you are treating conditions similar to its secondary effects, we must use low attenuations. Low attenuations. This is what we previously discussed. Make sure understanding these points. Coming to the next remedy. Remedies like calcarea, hypopos, Hecla lava. And I will tell you, Hecla lava is a beautiful, beautiful remedy for exotosis, for bony deformities, for necrosis of the jaw, teeth. I think I'm getting some messages. I'll just see it once the session is done for sure, because my phone is on charging. I'll just look after it. Try to concentrate here. So Hecla lava, calcarea, hypopos are very, very beautiful remedies in bony deformities in back and legs. In necrosis of the jaw bones also, this is a wonderful remedy. Wonderful remedy. That is what. Exotosis by itself has been treated with these remedies like phosphorus, Hecla lava, aurum, and ruta. This is Sir's clinical experience. But Hecla lava is a wonderful remedy, which I did in almost all cases. Aurum as well. Aurum has this rubric that caries of the long bones. Aurum also have this symptom. That is necrosis. It's a kind of necrosis there, you can see. Burnett, Cardus myrrh as a remedy for varicose veins. This we have discussed in our first session as well. So Burnett says that Cardus myrrh is a wonderful remedy for varicose veins. But he said to prescribe in Q. But not, I generally don't use mother teachers. You can prescribe in 3x or 6x. It works wonders. Coming to the next point, how do these nosodes cure? What exactly? Please, someone screen their having line. Please don't do that. How do these nosodes cure, and what exactly is their action other than under the law of similarity? Dr. M.L. Taylor, we know she's a beautiful writer actually, which she had delivered in 1932. The title of the lecture was Modern Concept of Hahnemann's Theory of Chronic Diseases, that is, any acute illness not necessarily caused by only chronic infection may remain completely uncured in the body and continues to grow slowly, indecisively for years and end inside the body, not begin removed by the effects of the body. Understand this. Understand. For example, if we hear of so many cases where the complaint is not being Welsing's, the attack of measles, never Welsing's attack of measles, morbillinum, never Welsing's attack of typhoid, fluoric acid, carbovage, never Welsing's attack of smallpox, verolinum, never Welsing's any influenza, can be carbovage. Influenza after lot of joint pains can be Lycopersicum esculentum. Influenza after lot of weakness can be carbovage. And influenza after lot of weakness, gelsemium. This is beauty. This you need to understand. That is what very, very important for this prescription of past history. In past history, never Welsing's jaundice after can be chelidonium, can be lycopodium, some intercurrent. So that's why this nosodes has come into the play of action to remove the insides, the inner patterns of the remedy, the inner growth or the side, the sora which is there in depth, the latent sora. That is what we can see there. This is some points for us research purpose. Steps for research: observation, theoretism, conclusion, trial, and verification. These 5 are most important for those who are entering into the research. This is just a simple slide. We made it there. Next remedy. Burnett discovered the use of Urticaria urens against gout. Studying its peculiar power of pushing out uric acid, sand in the urine. And beautiful, this is what I would say. Dr. Burnett is a wonderful prescriber in a homeopath. And he used urticaria urines for gout cases, And we did a one beautiful shot of urticaria urines, like if your sanguinaria canadensis, if your rostox, if your ferrum is failed in any joint pains, urticaria urines wonderfully works in continuous deltoid pains, especially at deltoid joint pain, shoulder pain, cannot able to lift, cannot able to move. You can think of this remedy there. And urticaria urines is a beautiful remedy for urticaria as well, and especially in the burns cases. The other remedy that generally we don't know, Glandum quercus. That is what quercus we generally think of alcoholic patient to like to divert the cravings, right? But this is a beautiful remedy for gout. Has cured more cases of gout than any other remedy in out of Metromedica. Quercus has done wonders. Quercus has done wonders. After reading this, I was so much astonished. Yeah, this is also there. Then I went for some documentations of this remedy. There are many cases. If you go through Google, you will get it there of treating this remedy with gout. Dr. Lippe says, if from the numerical totality of all symptoms of the case, we strike out all the symptoms, which can be explained by the pathology as due to the disease, the remaining symptoms are the symptoms of the patient, and they guide us to the selection of the remedy. Actually, this point is repeated, I feel, which this point we have discussed in the part 1. Will be uploading. This is generally like. Generally, we take into the as a beginner of a practitioner. Whenever patient says something, doctor, I have a headache. Chalo, open the repertory, headache. Modalities aggravated from sun. Add. So you are adding all the pathogenic rubrics like 1, 2, 3, 4, and you add some mind symptoms or some constitutional symptoms or some physical generals to the patient. When you about to delete the pathology symptoms, if you delete it in the repertory, the symptoms which are remaining will guide us through the selection of the remedy. That is what Lippe want to say. So you're not going to the superficial. Try to see the deeper pattern of the patient. Try to see who the patient in front of you, not what the patient is suffering from. That is also important. But who the patient in front of you in the suffering is more important than what the patient is suffering. This is picture of understanding the classical prescription. That is what we discussed already. Please, these lines are so much of disturbing. Someone has made it. Please do erase it. You can erase it. Condurango is the clinical records of Condurango showed that it is really has a genuine curative power over some cases of cancer, particularly of stomach. That's what I said, esophagus of stomach. Condurango. Dr. Wilkinson cured toothache, gum abscess, swellings about the jaws, and difficulty in dentition. It has arrested many forms of bony diseases, including osteosarcoma, scrofulous, that is tuberculosis, syphilitic, exotosis, cervical glands, indurated and infiltrated like a row of perils. I find it is wonderful effective in calcaneus spur cases. Condurango. This is the beauty of Condurango. Generally, we don't think of, but Wilkinson has cured these cases with Condurango. Coming to the next point, Boningusen unique experience. Now we are entering into understanding of Boningusen well. Potentizing increases the range of action of a drug. Inert substances become polycrust. High potencies increase the range of curative action. See, when two remedies are fairly similar to a disease picture, both will act as a simillimum, even if each does not cover everything. How beautiful. This is pathognomic symptom matching of Boningusen. Because he made pathognomic symptom, that is grand generalization. The higher potencies seems to offer a means of making the medicine more accessible and therefore homeopathically more effective. Homeopathically more effective there. Ignitia in serious septic conditions. What bad loss it will be for us if we don't know this most powerful antisepticemia remedy, that is ignitia. Dr. Koppikar sir said that he found only 3 remedies capable of curing bubinomic polgue, that is lachesis, anthracynum, and ignitia. Homeopathy in Medicine and Surgery by Edmund Cartillan says serious cases of appendicitis. In serious cases of appendicitis was cured by Ignitia 200 with profound results. Antisepticemic, think of lachesis, anthracynum, ignitia. And in serious cases of appendicitis, according to SP Koppikar Sars, Ignitia 200 has given profound results. The best way to study our system and the peculiar therapeutic techniques is to study the reported cases of real masters of the art. These you need to understand. So that's why to understand these cases of each and every master, try to read Burnett books, Dr. Burnett books, Dr. Grimmer's books, collected works from Burnett. There are many books of Burnett, we'll be sharing it, and collected works from Grimmer as well. Fatak real cases, you will get it. J.T. Kent lesser writings, you will get it there. Boningusen lesser writings, you will get it there. Boger's lesser writings also. They have mentioned a lot of cases, their experience. This is the original path of learning homeopathy. But we generally avoid all these and go into a state of guided books, some S.K. Dubey, etc. I'm not saying they are not at all useful. They are useful, but that is not the actual homeopathy. That is not the actual learning of homeopathy. It lies deeper. The old books, the real master reported cases are so useful to understand the classical prescription. Those who are want of these books, they can ping me. We'll be sharing you personally. Those who are really interested. My experience with colic of caliculae. Chelidonium pain is very tender. Gallbladders aggravated from jars, lying on right side, amel by formication, amel by hot drinks. As I said, Chelidonium craves for hot craving. Fumes must come out of that. Such a hot drinks Chelidonium craves. Kidney colic is a terrible thing. The only two remedies I found effective were beriberi and tabacum. Acute troubles of colic is the best cured by sarsaparilla. So tabacum to prescribe with a lot of nauseating feeling you need to have. Beriberi wandering like pains, shifting pains, especially it goes from the thigh regions. Sarsaparilla pains with sandy urine, red sand urine, you can think of sarsaparilla there. Other remedy, I think here to mention, China. China is a beautiful remedy for gallstone colics. I have heard from my friend Dr. P.V. Venkatramana that nitric acid 30 dilates the ureter and helps to get the oxalate stones. How beautiful is this? Nitric acid. Hahnemann had given detailed accounts of the treatment to be adapted if psora is complicated with syphilis and gonorrhea. He advised the piecemeal treatment is first dose of Thuja for gonorrhea and the Merck for syphilis and then sulfur. That's why these all are antisoric, antipsychotic and antisyphilitic remedies according to the master, the great master Hahnemann. To bring down the blood pressure, think of amylonitrazome 30 or 200, aconite 30, arsenic 200 and ipecac 30. This is according to SARS experience. Still, I am saying this is according to SARS experience. But I found results with nitramur if it is indicated. Scoparium is also a wonderful remedy if it is indicated where there is high systolic and high diastolic. You can think of Scoparium spartum scoparium. It's a spider remedy. In low potencies, it works wonders. Dr. P. Banerjee says, always treat the simplest thing first. Start with antipsychotic, then go to syphilis, and then psora is in treating. This always saves time and worry. This is some doctors' experience to treat, starting with antipsychotic, then go to antisyphilitic, then go to the inner depth of psora, that is antisoric. Tuberculosis. This is wonderful explanation given in this book. Tuberculosis adenoids along with the nosode, bacillinum, 200,000 and 10 can work wonders. Belladonna 6, it has been given daily 2 doses of 2 to 4 pills. Large, threatening, hard glands along with fever, etc. are cured. I think belladonna is a truly anti-tubercular remedy. Belladonna is a truly anti-tubercular remedy according to SP Koppikar Sars. Calcarea carb in the morning, ferromate in the midday, arnica in the night for TB of lungs. They all greatly improved. Stanum at 6x30, it is a great tonic remedy. Pulsatilla, it may not cure, but it is a great solace to the cough, etc. of bad cases. Here you see the C point, calcarea in the morning, ferromate in the midday, arnica in the night. According to SIRS, at the time of 70 years of experience when he was in the 80s, 90s, this was the prescription. But generally, at present day, we need to go with the single remedy classical prescription. If possible, you can have an intercurrent along with the past history based on the patient lookup. That you need to keep in mind. Dr. Thomas Snicker is a very useful. He, of course, used it for some of his brilliant cases of curing high potencies. The advice is the symptoms last to appear are always the guide to prescription. Whatever may be the 100 other troubles, and the present acute condition must guide the doctor in the selection. The doctor in the selection. The last symptoms which are going to appear is the guide for prescription. This clearly indicates the Herring law of guidance, the law of cure. The following treatment has been evolved as a standard treatment and can be tried in every case of this allergic bronchitis with a history of the preventive vaccinations like Drosera 1000, 2 doses in water on same day 4 hourly, Thuja 1000 even if it is not vaccinated against smallpox. Pertussin 1000 is wonderful remedy as well for tuberculosis. Sulfur, calcarea carb, lyco, pulsatilla, silicia, nitrum were indicated by constitution in 1000. Basilinum 1000 or tuberculinum aviarii 1000. In basilinum in bronchiectasis or tonsillitis, it's been very important. Tuberculum aviarii when dyspnea is more with rapid breathing and pneumonia. Understand these indications. It is beautifully written. These are the modified cycle is repeated at the intervals of 10 to 15 days. The next cycle is repeated every 3 to 4 weeks. So we can substitute nitrum sulf 1000 for the sulfur, etc. in one cycle if parents having asthmatic history. Now I will tell you. There is one rubric from FATAC actually. Asthma psychotic, only three remedies. Psychotic asthma, that is from the parental history. You can think of medorinum, nitrum sulf, and silicia. These three remedies works wonders if there is past history and family history of asthma. Have you used petroleum in gastric or such troubles? Yes. If so, understand this. If the stomach pain is better by eating and a few of its symptoms are present, we can think of petroleum. In gastric ulcers if the patient says better by eating. Petroleum highly cures more cases than anacardium, chelidonium, graphitis and sulfur, which have also the same amelioration, that is better by eating. How beauty. So generally we think of petroleum from dry skin, cracked skin. It's beyond that. Thalassi bursa pastoris Q or 3X, extremely valuable for fibroids, bleeding profusely with sore pains and clots. Okay, I will tell you one beautiful clinical tip of Thalassi bursa pastoris. And it is one of the beautiful remedy for ill suppressed uterine diseases. Burnett has mentioned this. If there is a case of suppressed uterine diseases, then everything has started. You can think of the remedy Thalassi bursa pastoris. And from Boric, I want to say Boric. He says, generally female patients comes and says, doctor, my period has occurred 15 days. Within completion of within 2 or 3 days, again the bleeding started. They feel the next period appears. In such cases, Thalassi bursa pastoris works wonders. And other clinical tip for you all, which is I think you have never heard it. It's a beautiful remedy for gallstones. Thalassi bursa pastoris is a beautiful remedy for gallstones, as Burnett has used wonderfully with pulsatilla like mind state, and you have a picture of gallstones. Think of Thalassi bursa pastoris. Trillium, it's a wonderful anti-hemorrhagic remedy. Menopausal bleeding, bright red, And this is quite opposite to lachesis, that is amel by tight bandages, opposite to lachesis with excess lochia. Xanthosylum, we already discussed. Xanthosylum is a wonderful remedy for dysmenorrhea cases. A lot of pains during menses. You have prescribed MAC-PAUSE, Skippy, all the remedies, nothing is working. You can think of Xanthosylum 30 or 6C wonderfully works in dysmenorrhea cases. And the patient says, doctor, now my pain in that going down the thighs, the pain is going down the thighs. With a lot of headaches, you can think of the remedy Xanthosylum. Nowadays, our biggest problem is to undo the suppressions and damage that are caused by very powerful drugs of the other schools, especially when the hormones, antibiotics are used in large tolerated doses. So I am telling hormones, right? I'll tell you one clinical tip for you all. So whenever you get a case of PCOD and patient says, doctor, I have used OC pills for my suppress of menses because I need to visit temple, so I used some pills. Then after that, now all my complaints of irregular menses have started. This has been from 6 years, 1 year, and I had taken homeopathic treatment, doctor. Homeopathic treatment. Sir has prescribed, well, I think he has prescribed constitution. This is what I am just explaining you. But menses have come again. It is repeating irregular. What I can do now? See, this hormonal has caused the suppression. Now the homeopathic doctor, whatever he prescribed, is the right remedy, but the suppression which is undone in the inside the body is not at all coming up, right? In such cases, you can think of the remedy Alistrochia climatrix. Alistrochia climatrix 30C does wonders. It's a mixture of arnica, sepia, and arsenic. We'll share about that remedy well. It's a beautiful, beautiful remedy. Like OC pills misusage with PCOD cases. With PCOD cases are used in large tolerated doses. Either the body is unable to eliminate them completely so that they leave their stamp on the economy of the patient, or they deflect the vital force from its normal functioning for the life. These cases nowadays we are getting. This is what we are facing in our clinic generally, because many people won't come to our clinic directly. They go allopathy, they go specialist, they go other specialists, they go other PhD doctors, then they go to Ayurvedic, then they go to some unscientific treatments, then they come to homeopathy. Now, what the suppressions of the patient is there, we need to understand it very clearly, very clearly. Then our medicine works. This is what we are failing. This is we are failing, not the system, not the system. Clearly, I want to say, because we are not understanding the actual picture, because we are not understanding the suppressed picture. We are just understanding the superficial layer of the patient. Understand this, my dear doctors. The success lies in understanding the deeper pattern of the patient who is in front of you. The patch of eczema, like eruptions on the nape of the neck by the margin of hair, got well with Natrum. This I will tell you. If there is eruptions, especially at the margin of the hairs, behind the margin of the hairs, you can think of the remedy Natrum and Tellurium metallicum. Tellurium metallicum. It works wonders, and rustox as well. Rustox as well, especially behind the ears. Behind the ears. Fatak sir has mentioned eczema, hair, margins, Hydrustis canadensis. Kent sir has mentioned sulfur. Single remedy behind the ears. So here complete our session of 100 points. This 50 and the next 50 of part 1 we are going to upload. And thank you all who have joined our session. You can share the feedbacks in the chats. Please share your feedbacks. Once the feedback session is done, we'll have a discussion session. Please, everyone, share your feedback. That will be very, very important for us. And subscribe our channel. Make it 1,000 subscribers. We are coming up with a special video very soon. And you can scan this QR to get our social media networking there. You can join our session for further updates as well. You can scan this PPT will be there, slide will be there. Please share your feedbacks. There are about 30 members. Actually, the registrations are many, like above 160 registrations, but many have not attended. No issues. Please, everyone share your feedback and what you have learned from this session is most important. that you can have a text there that will be helpful for us in further sessions. I'm expecting almost all the 30 doctors who have attended here. Please share your feedbacks. 31 doctors nearly. Please share your feedbacks, and we will be sharing the PPT as well to your email ID, what you have given while registration. Most probably we'll be sharing PPTs to your email. Yeah, please share your feedbacks. We'll have a discussion. Thank you for all your feedbacks. Thank you all. And if you have any doubts, we'll have a discussion. Yes. Thank you. Everyone will be receiving the PPT, and each and everyone, please subscribe our channels, YouTube channel. We are going to upload the videos there and make it 1,000. Try to share it to all of your college mates, classmates, junior, seniors. When there is a lot of more reach, I can share you wholeheartedly. This session is for you all, and practice in a right way. Sure, we'll be making more videos. Our PPT is also ready. The only thing you all people has to do is make sure it reaches to many homeopaths across the world. Share to your students, your guidance, your juniors, your seniors, everyone. Please share it. Once our subscribers are hitting high, we'll have wonderful sessions, free sessions, generally free sessions, so that every homeopath has to learn the actual prescription. And we'll be sharing a lot of books, PDFs in our Telegram channel as well. You can have look at there to join our Telegram. Some beautiful books which are need for every homeopath. And if you have any doubts, we'll have a discussion. You can post your doubts right now. Okay, for frozen shoulder. Yeah, for frozen shoulder, if it is a right-sided, actually, if it is right-sided, sanguinaria canadensis. If it is left-sided, ferromate, nux mostata also have this action. Yeah, that's what. And urticaria urens as well. Yeah, we'll have it. Actually, I'm planning to have a Burnett's literature books very soon. That is what we have, some special videos for you all. Once if you all share our channel and make it 1K subscribers, for sure we'll have a wonderful book, actually, wonderful book waiting for you all to make it. Still, if you have any doubts, I will be available for 2 or 3 minutes. If not, we'll have end the session. And if you have any suggestions further, you can just post it down. We'll look after it and we can go accordingly as well. Urticaria of allergy of chronic urticaria, especially of brinjal. In such cases, we can think of Solanaceae family remedies. Actually, it has worked wonders. The other remedies also for urticaria is rose toxicodendron. It's based on eruptions, actually. Even Bovista also have this urticaria symptoms, actually excitement of the. Yeah, please share Telegram link. A Telegram link will be here. Like if you scan this QR code, everyone, if you scan this QR code, you will get almost all my links of Telegram, WhatsApp group and WhatsApp channel, and our Instagram and our YouTube as well. You can scan this or just take a picture. You can scan later and you can join our Telegram there. Yeah, allergic rhinitis with constant sneezing, any medication for this suggestion. First, you need to understand the modalities. When it is more, when it is less, any past history. If you're not getting anything from there, you can think of the remedy as iodatum, Viatia, ambrosia, arunda, sabadilla. Sabadilla is a mixture of Viatia, ambrosia, arudo. So these are some remedies. Even arsenic iodatum works wonders. If it is not at all any response, any remedy is not working, you can think of these remedies. But try to interlink like Viatia with allergic rhinitis, itching in the eyes, you can see. Ambrosia, itching in the left highest palate in the mouth. There are some difference that you need to understand. Above all, ars iodatum 30 will do wonders. Okay, headache is done in IFPH channel, right? Yeah, in International Forum of Promoting Homeopathy, we have done 2 sessions. One is on headaches. If you type in the Google, the YouTube IFPH Dr. Manidrupath, you'll get about 2 videos. One is on rheumatism, other one is on headaches. Doctor, please comment suggestion for the trembling of right-sided hands and arms after vaccination of COVID. So ill effects of vaccination, you can think of Thuja, argentum nitricum as well, even silicia also. But a trembling, you need to understand the cause. You need to understand the cause. There is one remedy called Lolium temulatum. Lolium temulatum from boric you can read. Even trembling from slightest exertion, cannot able to walk, write, even the catching of the pen, they causes trembling. That you need to understand. And you need to understand the changes of the body before and after. You can text me in my WhatsApp for the whole case, what to be asked and what not to be asked. We'll have a suggestion and we can prescribe the remedy there. Okay, I am ending the session. Thank you, and thank you everyone for joining. Please subscribe our channel, join in our as well. Thank you for your support. All these videos are going to be uploaded. Yeah, trembling and anxiety. In such cases, you can think of staphysagria as well, with a lot of trembling, especially after anger. See here, good question, anxiety. Now you need to understand in depth why this anxiety is occurring. What could be the probable cause for this anxiety? Anxiety for health can be arsenic. Anxiety for care for worries of children can be causticum. Anxiety care worries for his parents with trembling can be cocculus. It depends on the anxiety for what level. What could be the cause? There you need to understand. Okay, thank you. And thank you everyone for your wonderful support. Make supporting us like this. We'll be having a wonderful time. Any medicine for headache after eating ghee or lemon? There is no particular remedy actually, but lemon aggravation, there are, see in these cases, you need to have a general look after it. Like for example, if you go into the repertory, having headache, aggravation after ghee, you are not going to find it. Having headaches, aggravation after lemon, you are not going to find it. Try to make it as a generalized rubric. Go into generalities of food and drinks, aggravation from lemon, aggravation from ghee. Ghee is a milk product. So milk products aggravation. Then you will get some remedies of 2 or 3. You need to cross question what the 2 or 3 remedies the patient belonging to. At the same time, how the headache is, type of pain, modalities, amelioration, that all matters there. That all matters. We'll have a session this like how to take the rubrics in right pattern, when to consider general rubrics, when to consider pathognomic rubrics, when to apply striking rubrics. That we'll have very soon, very soon. Thank you everyone for joining our session. Please supporting us like this. We'll have a beautiful sessions for you all. This session is from my wholehearted to spread the classical actual homeopathy. Thank you everyone.